And I do want to shift the conversation a bit into this, the issue at hand, which seems to be that PATs are often stalled because of this translational gap between development teams and manufacturing teams. And I'm curious, whoever wants to start here, what factors do you think lead PATs to get trapped in this technology transfer between pilot scale and GMP, the process development team and the manufacturing team? What factors are at play there? And then maybe we could dig into a little bit of how to actually address this gap institutionally. Luke, you're on my screen. Did you want to go?
Yeah, I can try to illustrate what I was saying in the introduction, right? So because the ambitions from R&D, MSAT, and manufacturing and supplies are different, right, in terms of PAT deliveries. And we are working still more in functions, right? We have R&D, and then we have MSAT, and then we have manufacturing and supply. One of the most important factor is to create a clear program which embeds, the business needs from manufacturing, from MSAT, and from R&D, in order to establish a strategic continuum, right? And with a PAT strategic continuum from R&D up to manufacturing, we would ease, the different level of barriers that are facing the different functions, right? If I take the example, let's say, of Raman, right? So Raman, for process design and process understanding, is very critical for R&D in terms of increasing their knowledge and therefore accelerating their process development step, right? So the more information we have on Raman, the better in terms of number of concentration, metabolites, and so on. But once we have designed this understanding in the R&D space, within MSAT, as we are closer to operation, and we are the expert in terms of process for operations, what we need to establish is what type of true metabolites needs to be controlled for operation. So out of the 20 or 30 type of models and concentration that R&D was establishing, within MSAT, we need to streamline these to maybe one or two that have the most impact within the quality by design or the design space of the process step, right? And once we have designed this streamlining, then we can offer to manufacturing a type of easy solution that brings the value that we want, right? Without all of the additional activities and additional information that were needed for R&D. So a streamlining PAT continuum from R&D up to manufacturing, I think, is key to increase the level of adoption and reduce the level of complexity.
Thank you, Luke. Did anybody else want to answer before we take a look at these poll results?
Yeah, maybe I can also comment. I think in Novartis, like one of the biggest challenge we have been facing is exactly like this, sitting in development. We're actually doing quite a lot of proof of concept with different PAT technologies, with many different use cases, which, would help actually better understanding of the process and so on and so forth. However, when we want to get it implemented in manufacturing, I think earlier on it was mentioned that with established process and established facility is actually very hard to convince or make the adoption happen, because they would need to have a lot of changes and also qualification of the equipment and the investment capex and so on and so forth. And they would need to really have a big business justification why it is important for them. And this is particularly difficult if we think about one established process with established control strategy, which is based on some fixed time window, let's say. Now, if we want to steer a process now based on a PAT sensor signal, then we would need to actually do a lot of post-approval modifications, which is, of course, no one would like to have it, right? And then, that's why I think it is very important. That's a, lesson that we have learned. It's really, like Luke was mentioning, it is really important to really start early on aligning on the objectives, what we would like to achieve. Alternatively, once we have it implemented in manufacturing, and also having that objective maybe embedded in the development goal of it, because not necessarily development would benefit directly from such a method if we are thinking about real-time monitoring and process consistency, which is often not the main objective of the development. However, it would enable early development with aligned objective to develop such a method that could be beneficial in the end. So I think having this alignment very early young and having important to have.
Thank you, Mingyang.
I think I would add a few factors which cause the delay or for the PAT implementation. For the small biotech company, funding is big limits. So timing, let's see, early stage versus late stage, or even post-approval in continuous improvements. So those are factors as well. Technology maturation is the current probe technology is mature enough, so we could use that, for PD study, then get up, apply to the large scale. So those kind of factors also can think about that. So thanks to large, big farm, they already done a tremendous good job, and then encourage us to consider this. Last is not least is CDMOs. Smaller biotech companies solely rely on CDMOs. And the CDMOs, they are hesitant to implement PAT. I think there are multiple factors there. One thing is related to the project, molecule to molecule. We know the case by case from each molecule. So if PAT, if the one particular technology can fit to particular project, so that's another factor to for the PAT application. Okay, so I add these few factors for discussion.